Liposuction is probably one of the most well-known procedures in plastic surgery. It routinely ranks at the top of the list annually when the statistics come out of which cosmetic procedures were performed every year in the United States. Liposuction is a way of contouring areas of the body that have excess fat that has been refractory or hasn't responded to traditional methods of losing fat like diet and exercise. So for the ideal liposuction patient, it's a patient who already is trying or is at least on a pathway to physical fitness, who's trying to eat right and exercise, but still has areas that just won't respond despite their best efforts. It's kind of a sculpting tool. I always say it's like, having a sculpture that's almost finished but has some rough edges that need to be gently honed or sculpted. It's not really intended to be the tool that takes an unsculpted image, like a lump of clay, and turns it into a sculpture. It certainly can be used in that manner, and it is used in that manner in some instances, but I think it's best employed or best used when it's used to gently sculpt or contour areas that just haven't responded to the patient's best effort. So the best candidates for liposuction are patients who are already physically fit, who are attempting to maintain a reasonable diet, but still haven't achieved their goals with regards to their contour. Liposuction works wonderfully for women who say, my clothing fits but doesn't quite fit right in all of the areas, or when I wear certain types of clothing or a bathing suit, that there's areas that I just can't improve. And so liposuction gives us a tool that allows us to sculpt those areas and bring them into greater harmony with the patient's overall body shape. So there's lots of different types of liposuction, and it's important to understand that behind every type of liposuction, there's often an impetus for or a reason why that form of liposuction has kind of come into existence. So certainly there is conventional tumescent liposuction, which is a way that fluid is infused into fatty tissue that allows us to then remove or suction the fatty tissue back out. So tumescent liposuction is one of the oldest forms of liposuction and is still probably the most commonly used form of liposuction today. Over the last 10 to 15 years or more, numerous different companies have come to the market that have allowed us to place energy into the fatty tissue before we suction it out. And what this allows us to do as surgeons is to, in some fashion, break down the fat before we suction it out. So most of these techniques use an additional step where fluid is still put into the fatty tissue, but then either ultrasound energy or laser energy or some vibration power is used to break up the fat, and then the fat is suctioned back out. It's important to realize that good studies have been done in plastic surgery to determine, do any of these techniques matter? Do you get better results with one versus the other? And what's really been shown is that there's really not a huge demonstrable difference between these different techniques. What's always been shown to be of the most importance is who does the liposuction, not so much what tool is used to perform the liposuction. So here at Park Meadows Cosmetic Surgery, we've used all of the different methods of liposuction. We've used ultrasound liposuction, we've used laser liposuction. Today, probably one of our most common techniques is simple tumescent liposuction. We do use power-assisted liposuction as well. In essence, we employ or we use whichever technique is most appropriate for the patient. It is important to understand that some of these other techniques that use different forms of energy to break down the fat often come at an additional cost, so we're always trying to balance that cost to benefit ratio for the patient. At the end of the day, for us here, it's not about using a clever marketing strategy, it's giving the patient the best possible outcome.